All right. So, hello everyone. I am joined by Dr. Mintz, who has very generously given of his time to share his wealth of experience in private practice, in concierge medicine, in direct primary care. And so, Dr. Mintz, first and foremost, I just have to say a very, very big thank you.
My pleasure. Happy to be here.
Awesome. Maybe we can start off with you introducing yourself and just letting everyone know who you are, um, where you work, all the things.
Sure. So my name is Matthew Mintz. I'm an internal medicine primary care physician. I've been in practice for 27 years. The first 20 were as full-time faculty at George Washington University. So I did a whole academic career for 20 years. And then for a variety of reasons, and we can go into some of the details, left to start my own concierge DPC practice about 7 years ago. Along the way, I've started other practice types and service lines, and some specialty direct care and some primary direct care, and I'm actually in the process of transitioning my practice to more integrative and functional medicine. So I have a lot of plates in the air. I don't know what the analogy is.
Yeah.
But things are doing well, and now because I've have experience and I've started a lot of practice lines or practices in the direct care space, I now like helping other young doctors start their own practice. So I've actually started a consulting agency, or not agency, but service for those that need some additional help. So I do lots of different things.
Yes. Wow. This is incredible. And this is why I'm so glad we got to connect because I think you have such a wealth of experience, certainly from the academic medicine standpoint. And then in private practice, as you said, you've done so many different things. Like I mentioned to you, you came highly recommended as someone I
Oh,
absolutely
thank you,
had
thank you, thank you.
someone I absolutely had to connect with. And I would love to hear more about the integrative medicine and the functional medicine work that you're even doing. For others who are listening, maybe people would actually be interested, especially if they're in the DMV area.
Yeah. So I'll start with, if for people just starting out, I think the first thing that I recommend that people do is think about what their practice vision is.
Mm,
In other words, when you're starting private practice, especially if you're starting right out of residency, there's all the logistic worries. Like, how am I going to pay my salary? How am I going to afford to start a practice? Where are my patients going to come from? How much should I charge? How am I going to do a website? Like, what's my logo? Like, people get bogged down in the nitty gritty, and
mm,
sometimes you can that actually leads you to making not the best decisions. And you really want to start from what I call creating your practice vision, which
wow.
is which is very broad strokes. It's very
Mm,
big picture. In other words, in 3 years, if you get, money's not an issue, patients are not an issue. Just imagine, if you will, 3 years from now, you had the
mm,
practice of your dreams. You could do whatever
mm.
you wanted. Like, what would that look like? What kind
Yeah.
of medicine would you be practicing? What kind of patients would you see? What would
Mm,
your schedule be like? How much
mm,
direct patient care would you do? How much other time will you have for yourself or your family? Like, what does that look like? And then
yeah. Mm,
um, once you have that vision, then you can work backwards to how to get there.
mm,
Now for me, integrative medicine was not my initial vision. That's sort of something I stumbled across. But
mm,
I sort of did it that way, and that led me to some good decisions, but also led me to some bad decisions. If I really thought about, like, what do I really want to do, maybe
mhm,
I might have started with the integrative medicine piece. But I was coming from I left academics after 20 years at a
mm,
much later point in my career. So I
mm,
was really super concerned about basically money. That's one of
mm,
the reasons why I left academics. So,
mm,
I started the concierge practice. We could go into that at the university. And one of the
mm.
reasons I stayed so long is I was doing a lot of education. The last 4 years I was in the dean's office. So I was dean at a medical school and a concierge doctor, and yet I was still making less money than the average family physician across the country, living in this high cost of living area that right around Washington, D.C.
We're in
So
the
that really,
DMV.
so that's sort of that math didn't add up for me. And so I sort of, so I left to sort of start my own practice. But again, much later in my career, I had two kids in high school that were about to go to college. How am I going to afford to send them to college? So I was really focused on the money, and I really should have taken a step back and said, what do I really want to do? So while, and it's okay if the vision changes, like if I'd thought about it, maybe I would have done more integrative medicine. But based on some of the services that I did, I sort of stumbled in, I would say, to integrative functional medicine. And about 3 years ago, after doing a deep dive into it, sort of decided this is where I think the future of medicine is going, and this is really what I want to do. So I'm in the process of transitioning so the bulk of my time and revenue are my concierge patients, my direct care patients. But my hope is that over time, that panel, I stopped taking patients about 2 years ago. And my hope is over time, my regular sort of primary care concierge patients goes down, and integrative functional medicine goes up. And so hopefully in 3 to 5 years, I'll be doing like 50-50. That's the goal.
Okay. And what are some of the services that you're providing in integrative medicine, functional medicine?
Right. Good question. So there's a lot that, functional medicine, integrative medicine is a lot of different things. It's not sort of one thing, and there's lots of different definitions for it. But in general, it's looking at, the way to help the body's sort of natural healing capacity, help those that are sick, and for those that are healthy, help them live longer and healthier. And so it's lifestyle medicine, diet, exercise, stress management, sleep, those things. So that's sort of the lifestyle component. But one of the things that differentiates, in my opinion, functional medicine from lifestyle medicine is we go into more of some of the other infections and toxins and do more testing and things like that. So things like, gut microbiome and gut dysfunction, and using prebiotics and probiotics, or looking for toxicities like mold toxicity, and if they have that, doing some of that. So the lifestyle part is still super, super important. But we do a little bit more than lifestyle. And so to me, that's fascinating and interesting. So because I still have a full panel of patients, I don't even advertise that I do functional medicine. So rather, I started adding service lines. So the first service line that I added is long COVID. So I do long COVID. Conventional medicine has no idea what to do with all these patients who, ever since they got COVID,
That is very true.
They don't know what to do. They have these headaches. They're fatigued. They're just not functioning well, and they've seen a million doctors, and no one knows what to do. And so that's a really good space for functional medicine, because even though long COVID is new, there's an overlap with like chronic fatigue, and integrative functional medicine doctors have been successful treating chronic fatigue for a very long time. And it's basically those same principles plus a few extra twists and turns, to get rid of spike protein. So I did that, and then most recently, about a month ago, I added longevity and anti-aging medicine, as well as bioidentical hormone replacement. So I started doing that. And then we'll see. So that's relative. Long COVID, I've been doing it for over a year. These two new services I just recently added, and how quickly I add other services or just say that I'm doing functional medicine, we'll have to see how this goes. I was just at a conference in Las Vegas, and I haven't decided this yet, but I'm thinking that the next service that I may do is anxiety and depression without medication. Because there's a huge connection to, mind, but, the gut, things like that, to mental health disorders. That it's interesting, most of mental health or psychiatry or whatever is based on the monoamine theory, that basically we have an imbalance of serotonin, norepinephrine, dopamine, and things like that. And if you just give a drug, that'll solve the problem. And the drugs work, but not always, and not without side effects. And, so for example, inflammation is probably a big component to, mental health disorders, and the monoamine part might be a secondary thing. And so there's a lot of interesting work being done in this space, and it fascinates me. So this is something I think I might want to do, even though I'm not a psychiatrist. I do think that there's a lot that can be done. And I think there's a lot of people out there who want, my own patients included, who don't want to take an antidepressant or like to get
Yes,
off their antidepressant or don't want to
absolutely.
be on the Ambien and would like to get off the Ambien. And so there
Mm-hmm.
are ways to do that. So that's probably my next service line. I
Wow.
just got back from this conference, and I'm thinking there's an integrative medicine medicine and mental health conference out in Baltimore. It's coming up in October at the
Okay.
Gaylord, and so I'm probably going to go to that for a day or two.
Okay.
So and after I go to that, I'll decide if I want to do that. But so lots of
Okay.
things going on.
Yeah, I absolutely love it. And I think for anyone else who's watching, it's certainly inspiring for me because it goes to show the amount of versatility that we have in our careers. I know you mentioned not being a psychiatrist, but I think one primary care doctor to another, we can definitely relate to seeing so much of anxiety and depression in the primary care space. And
Yeah.
I too can relate to having patients saying, well, I don't want to be on this medication forever. I don't want to take it at all, actually. So I think this is really great. It's novel. I think it could be very promising and helpful. Maybe not for everyone, but certainly for a good number of people, I would imagine. So
Yeah.
we'll have to see what you
I'll
decide.
have to check back in. Yeah, but I think the other thing that is that with these complex patients, the
Mm,
long COVID patients or, patients with fibromyalgia and chronic fatigue and things like that, what I'm finding, even with the long COVID, is they all have some history of trauma. They all have
mm,
some. So I think a lot of chronic diseases that we see in the primary care setting,
wow.
especially these really complicated, really challenging patients,
Mm,
if you start digging deep, you will get a history of trauma. I
wow.
guarantee it. And so then what do you do with that? Because,
Mm,
psychiatry, there's certainly a role for the psychiatrist in that,
mm,
but trauma is a challenging thing to deal with. And there are things that you can do to help with trauma that,
mm,
some conventional psychiatrists aren't even doing. But that's what
mm.
I'm finding. I'm finding more and more of my complex chronic disease primary care patients. If you dig deep enough, there's some history of trauma somewhere.
Yeah, wow, that is so eye-opening. I mean, off the topic, but I would love to read any research papers, anything like that that you've come across. I just find that very interesting and insightful too.
Yeah.
So, for others, I think other physicians, I think that's something to keep in mind. Sometimes it's worth trying to dig deeper and get to the root of it, because maybe if you address the root, we talk about root cause medicine a lot,
Right. So that's
right?
what functional medicine is.
Medicine
Functional
is,
medicine is basically root cause medicine. That's
yeah,
basically what it is. So what are the root causes? Diet, exercise,
yeah.
lifestyle,
Mm.
trauma, stress,
Trauma. Mhm.
toxins, infections. It's
Mm.
all, that's why I think that's why I'm interested in it, because I think that's where medicine, I mean, I'm not anti-conventional medicine. I mean,
Right.
so I'm a little older than you. I'm a lot older than you, actually. Like, so in my residency training, when I was training in the mid to late 90s, that was the height of the AIDS epidemic. And so half the patients on the
Mm.
medical wards when I was a student resident were all HIV patients that were
Mm.
dying of opportunistic infections, and we didn't
Mm.
have anything. And then the protease inhibitors came out, and now it's like, if HIV, you just take a pill a day and you're fine.
Yeah.
Like, I mean,
That's,
it was a death sentence when I was in medical school and residency, and now it's like it's like diabetes. It's like not anything different. And so,
mm.
modern medicine is amazing. We've come up with some amazing treatments for,
Yes.
severe diseases, but
Yes.
we really are best suited for acute disease. We're not really well
Mhm.
suited for these chronic diseases, which you
Yes.
and I in the primary care space deal with all the time.
All the time. Hmm.
So, but back to what you said before, yeah, I have a lot of services that I offer, and there are a lot of services. There are a lot of things that we can do
Mm.
as primary care generalist physicians. Family physicians, internal medicine physicians,
Yeah. Mhm.
pediatricians to some degree. Even OBGYNs to some degree. Those that are in the primary care space. There's a lot
Mm.
of things that we can do, and that's why I say, you can do what you can have the practice of your dreams. You can do whatever you want.
Mm.
You have to make some decisions, but start with that picture. Like, if you really love women's healthcare and that's what you want to do women's
And see that.
healthcare. Don't worry
Hmm.
about how am I going to make money doing women's healthcare. Say, I'm going to do women's healthcare, and then work
Mm.
backwards and figure out how can we make this work.
I love that. That's actually very practical. And, you know, you hear people, I come across a lot of people who are saying, you know, I want to go into practice. I want to have a private practice, but that is so good to say, start with the vision, right? Yes, we can get into all the logistics, but let's start to make sure you're building exactly this dream practice that you want, even though it might change here and there. Keeping the vision in mind from day one, I think is
Yeah.
so key. And that's a practical question you ask. 3, 5 years from now, what exactly do you want this practice to look like? And let's work backwards. So even along those lines, going back in time to your early days, how did you have a specific patient population in mind? You know, you came from the academic medicine
Yeah.
world. You know, did you have a specific patient population you always wanted to take care of, specific type of work? I know now it's shifted, right,
Right.
towards integrated functional. And then in addition to that, how did you find them?
Right. So, all right. So so again, so I started Concierge halfway through my academic career.
Mm,
So, and it wasn't something I was seeking out. I was very happy at my institution. I got really, really lucky early on that I got some teaching roles as a very junior faculty. So I was course director for a number of courses. And pretty
mm,
soon after a couple of years, I was like 50% education and
wow.
50% clinical. So it was great. I did
Yeah.
1 or 2 resident clinics, which was great. I
Mhm.
got to teach. I had 3 of my own clinics where I saw, you know, your typical academic patient population in Washington, D.C., which is a
Mhm.
wonderful mix of, you know, some of the wealthy,
Everything.
affluent people that come to the
Mhm.
university because they want the best healthcare, and some of the highly, you know, disadvantaged folks because we take their insurance and they happen to
Yeah.
be working there. So it was
Yeah.
wonderful. I saw, you know, senators and congressmen and people on Medicaid. Like it was
Mhm.
great. Loved it. So,
Yeah.
but and so I was teaching, I was seeing great patients, I was doing wonderful things. The only downside, besides my long commute, which we talked about before we started this, was the salary. That academic physicians get very little, primary care physicians get very little, and the intersection of that, you know, primary care and academic medicine is not great,
Mm,
especially you know, especially in a very expensive area like Washington, D.C. So
yeah.
about 10 years into my career, I went to my boss and I said, you know, it's been a great run. I hate to leave, but I can't stay here because you can't pay me anymore. And so
Mm,
I was going to leave and start my own private practice, not really wanting to do that. And my
yeah.
boss came up with the idea of a concierge practice. It's not
Wow.
my idea to do that. He's like, you know,
Wow.
we've been thinking about doing concierge. You'd be a good person to do it. Come up with a business plan and let's see if we can make it work. So
Okay.
I came up with a business plan without any experience, and I met with the CEO of the faculty practice, and we
Wow.
started it. And what was good about it to some degree was I was able to start a concierge practice while being a salaried physician. So
Yes.
so there wasn't so while there was some pressure to get the practice off the ground, I did have a steady paycheck. Now the
Mhm.
problem is the problem that surfaced later on is that the deal we made was not the salary that I needed. It was just enough to keep me from leaving. And so
Mm,
and so the idea is I would get the practice up and running and very profitable, and that at some point, you know, they would bump my salary up, which basically never happened.
oh,
And so, but I had to, and also while it was good, I appreciated the opportunity. They really did nothing to support me in the terms of marketing or anything like
oh,
that.
wow.
Um,
Okay.
so I had to do my own marketing, my own research, my own outreach, all of that stuff. I mean, they did put up a page on their website, so
Okay.
so at least I got that. And so, for example, one of the things, because it was very slow to grow, I actually sort of stumbled upon through the hospital starting an international practice. So I started an international medicine practice because there I found an opportunity at the hospital with the hospital. So, you know, to pick up, I basically was looking for other opportunities, and I stumbled upon an opportunity with the hospital to start an international medicine practice because, you know, there are a lot of embassies in DC, and a lot of those, you know, foreign nationals would come to GW and would want these services. And, you know, the hospital could provide some of the hospital services, but not the outpatient services. And they were looking for that connection. And so I met with them. And so we started an international medicine clinic in addition to the concierge clinic. So that was a whole other opportunity, a new practice to start up. So I got a lot of experience starting practices. And so really your question was there a patient population I wanted to do? And really, ultimately, it was I wanted to stay at GW and be able to teach and see, to do the educational activities and see the patient population. And the concierge thing was not even something I was looking to do. But along the way, what happened was I realized, when I was doing the concierge practice and even the international medicine practice, I could spend so much more time with patients. And that I, I knew that I didn't think I was any better than my colleagues. I think my colleagues were quite good doctors, but I knew I was doing better medicine than them because I had more time with patients and more access. It's very hard to get in touch with your academic physician.
Yes.
You have to go through several layers, the patient portal and stuff like that. So I know that I saved, a lot of the insurance companies money and kept people out of the ER. And I know that I did good and it was fun too. It sort of brought back the fun to medicine because you could have a relationship, you could have time. You didn't have to worry about, I would tell my, the first thing I would say to my first patient of the day, the second patient of the day or the afternoon, not the first, but the second, was, I'm so sorry I'm late. Because you could either be on time or you could be good, but you can't be both. And so when you're seeing 15 patients, 12 patients in a half day, you can't be good. So you just run late and then you're notes and stuff like that. And that's not fun. This is why students don't want to go into primary care. They're like, this is a drag. I'm not getting that connection that I want. I'm always rushing. I have all this paperwork left over. And you're going to pay me less than a gastroenterologist. Why would I do this? So, concierge, it wasn't something I was thinking of, but it's sort of, it's sort of a light bulb shut up. I'm like, this is the way to go. Yes, it's not great that some people can't afford this. It would be great if everyone should have this kind of service, but why stay in a broken system, and provide subpar medicine and be unhappy and not be paid when there are other opportunities out there, and that's what I decided, and so I decided that was the right thing. And so when I decided to leave, when I realized that I could no longer stay, and I decided to open my own concierge practice, knowing the area, I sort of knew it wasn't so much a vision, but I knew that there was an opportunity to have a concierge practice right close to the area that I lived. And knowing the area, I knew that the geriatric population was going to be, going to be sort of my target. So, and so that's, going back to the vision, that's what I'm going to do a concierge practice. It's going to be mostly older people because I know I can grow that quickly. That's what I focused on. And so, for example, one of the things that I did is I looked at doctors that were retiring because I knew that a lot of the concierge doctors in my area were retiring or about to retire. So about a third of my initial patients came from those doctors. And I also, it helped, having that vision helped me with my marketing. So, I wanted people to, I knew that those seniors were frustrated. And so I wanted them to feel like it was back in the old days when they used to have a relationship with a doctor, but not these huge stacks of paper charts. Like we wanted to, have the new technology. So my tagline was sort of old-fashioned medicine for today's healthcare. So that was sort of the branding that I did, and that worked out really well. And I was able to fill up my panel within a couple of years, and it worked out really well.
That's incredible. That is incredible, and that's actually very insightful. I'm so glad you shared that. Sounds like you had figured out your niche, which would be more of the older population. But then I know you mentioned the referral. So just to dive a little deeper into marketing, because a lot of physicians don't really have much of a business background. Apologies.
Yeah.
A lot of physicians don't have a business background, right? So for someone who doesn't have much experience at all, it's early career, trying to start up this practice, what advice would you give them when it comes to marketing, practically speaking, and specifically for the concierge medicine patient?
Right. So I think, first of all, you have to know the difference between marketing and advertising. So marketing is basically how do you get your message? Marketing is how do you get your message out to the people and have them find you? Marketing is about, so you have your brand, which is your product. It's your brand is sort of an encapsulation of your product. It's your services, and marketing is how do you educate the people around you that those services are available? So it's more of an education thing, whereas advertising is where you pay money to sort of get eyes to see you. So you can so advertising is one way of marketing, but they're really it's really separate. And so that's one thing. Two is that, you know, like concierge direct care medicine is very unique. It's not like sorry about that. It's not like selling it's not like doing like a house cleaning service or a contracting service or a plumbing service or McDonald's or something like that. It's very, very unique, especially since most medicine is insurance-based medicine. So one thing is that, well, if you don't have experience, there are marketing people that can help you. This is still so new that I don't think a lot of the traditional marketing gurus or experts have those answers. And it's not that you shouldn't talk to them, but I think you should talk to people in the space that have the experience, so that you can understand what your product is, so that you can market it. And so because for example, you know, you'll hear, oh, you've got to go on social media and you've got to go on Instagram and you got to get, well, and that may be true for certain practices, but it's not true for everyone. So in my case, you know, my patients, you know, for the concierge practice, they're seniors. They're not on Instagram. They're not, you know, they're barely on email, right? So you know, so you have to think about, you know, who are my patients that are going to be value for my service, and what do they do? Where do they live? Where do they find that information? And then what's the best way for me to communicate that information? And so there are a lot of resources, you know, locally. So you have to know the service that you're offering. You have to know what patients would value that service, and you have to know what your community's like and where those people live. And you know, so that's why that goes back to why the vision is so important, because it'll help with some of those marketing decisions. So those are like sort of 3 key principles for marketing. And again, if that's not something that you're comfortable with, you know, get help. So there are, you know, there are direct primary care conferences that you could go to. They can give you some advice. You know, there are certainly marketing experts, but like I mentioned, you know, if you're going to pay for services, be very cautious, because they may not know you. And then, you know, go, you know, if there are a few, you know, physicians like myself who have been in the space, who offer services specifically, you know, to doctors trying to start up their practice. So that's, so I'm not, you know, I'm not a marketing expert per se. I can't place your Google ads for you. I'm not going to, you know, I'm not going to do your blog posts for you, but I can tell you whether or not blog posts would be worthwhile. I can tell you whether or not, you know, I could give you some potential avenues to start marketing your practice and some good ideas. And then if you felt like you needed Google ads or SEO help or something like that, I can put you in touch with, you know, people who do those kind of services. Because I mean, I'll use those services myself, but I've never used them for the concierge practice. I've used them for other things. So you have, so that's the other thing, is the way that I market. I've used different strategies for different service lines, because some things work well for one service line, they don't well for other service lines.
That's so important. Powerful. And so I think it might be helpful to give people a few practical examples. So if I can maybe ask, so especially because you've had so many different experiences actually starting up concierge practices. So if we think back to your GW days, because you did all of this, right? The marketing, what did you use to gain that clientele? And then you moved to the international medicine clinic. Right now you're dealing with senators, diplomats, etc. And then you had your own. So if you could give some examples of what tools you used for the concierge patients in those spaces.
Well, it's interesting. That's actually, I'll answer your question, but those are not really good examples, because one of the reasons I started the international program, because the concierge program wasn't really doing well, and I was not really given the resources to so here's one of the struggles. So most concierge doctors convert. So most concierge doctors, they're private practice, they have 2,000 3,000 patients, and then they send a letter to their patients saying that they're not taking insurance anymore and this is the new model. And so as long as 10% of those patients convert, you can get a good number of patients. Now, when I started, I was doing 50% education, so I didn't even have a full panel, and I had a lot of patients who were disadvantaged. So I didn't start with a high number to begin with, and my conversion rate was a little less than 10%. So I was sort of almost starting from scratch, and I wasn't given the sort of help that I could, that I needed to help market the practice. Okay, so I'll take it from there. So I can give you the answers for marketing at GW, but those were actually not positive examples, because while they offered me this amazing opportunity, they didn't give me any really support. I mean, they had a whole marketing team, but they really, other than build the website, which I helped them design, they really didn't, do that, plus, so I mean, I tried internally marketing. That was something that I did, talking to my colleagues, letting them know. One of the challenges is that the marketing strategy is, so I'm offering access, right? So the problem is I'm working in a medical center where access is poor, and but I can't really say access is poor, come see me, because I'm dissing all my colleagues. So it was a challenging situation, which, to be honest with you, I wasn't able to solve. One of the things I came up with that worked a little bit was we were trying to figure out what can we do to say not to diss the faculty practice, but to get people to understand that if they want better service, they're going to have to pay. So I came up with the idea of like cell phone, like, wouldn't you like your doctor's cell phone? And so they allowed me to put up posters in the elevators with that sort of messaging, like, this is our new practice where if you pay a little bit extra and you can get your doctor day or night by their cell phone. And while that helped a little bit, here's what I learned. What I learned is that patients were willing to see that, were willing to pay for that, but only if it was their doctor. In other words, they were working with Dr. Smith at GW, and they loved Dr. Smith, and they would pay money to get better access as Dr. Smith, but they wouldn't pay money to get access to somebody they didn't know. So that was very
They were already committed.
Right. So there was a lot of challenges to that. So that's when I sort of stumbled into the international medicine. And quite frankly, I didn't have to do any marketing for international medicine because they did it for me. Basically, the hospital was the one, basically the international patients would contact the hospital, and then the hospital would send me the patients. And so that was great. That was rocking and rolling really well. And that actually would have probably gone even better than the concierge practice. It's just that the dean actually, the last 4 years I was there, the dean asked me to come to the dean's office to revise the curriculum, which is what I really wanted to do. So I actually stopped the international practice. I stopped everything and only did my small concierge practice. So the last 4 years, I was like 80% dean and 20% concierge doctor. So the better marketing examples are, for some of the services that I just started. So for example, one of the things that I do is I do medical weight loss. And so what I knew is, so where are my, what are these patients? And these patients are all these many people that they see their friend or their relative, they're on Ozempic and they want to get on it and their doctor won't prescribe it or is uncomfortable with it. So I knew that the best way to market that practice was to go online, was that people were going to Google, medical weight loss doctors or doctors that give Ozempic or something like that.
Right.
And fortunately, for somebody, I learned a little bit about SEO, which, if people don't know, stands for search engine optimization, which is how people find you on Google. And so I was paying for a website already that had good SEO. So all I had to do was know how to put up the right verbiage on my webpage. And so I put all my effort into my webpage. And that was all that I needed for that. So that was one thing. And this is still new, so I can't, I can't tell you whether it's going to work or not. So one of my newest services is longevity and anti-aging medicine. And so like, who are those patients? Well, they're not really my current 65, 70, 75-year-olds, though maybe some of them. They're really my 50-year-olds, right? 50-year-olds who are educated, who like listen to Peter Attia's podcast and stuff like that, and have a little bit of extra money that they're willing to put into their healthcare. So I'm looking outside. It's raining outside now, but so hopefully if the weather holds up, tomorrow morning I'm going to the farmers market in my area.
really?
And I'm going to start, because think people who go to a farmer's market, they're getting up on a weekend and they're paying extra money for good, high quality health. Why do they want to eat organic foods? Well, maybe they like farmers, but no, it's because it's better and it's healthier, and it's a little bit more expensive, but it's worth it to them. So that's the perfect population. So we're going to do that. And I'm also going to try, part of the purpose of the farmers market is I'm going to do a dinner. I'm going to do like a dinner presentation. So we're going to invite potential patients. The idea is to collect names and emails to invite them to a dinner to tell them more about my longevity program, and hopefully they'll sign up. So that's the first step. We'll see. I just really put this on the website like a month or so ago. So we'll see how that works. So
Amazing.
right. So every service is marketed a little bit differently. So it really depends. So you have to really know your location, your service, your area, and it's different. And what applies here in a suburb of Washington D.C. may not be true of Kansas City. So everything's
Very true.
Yeah.
Very, very true. This is so good. Now looking back over the years, you've actually shared so much insight. I want to ask you one more question,
Sure.
and then I actually want you to talk to us a little bit more about what you do on the consulting side for other physicians. And so, if you could go back in time, what hurdles did you overcome that you would like other young early career physicians to know?
That's a great question. That's a great question.
And how to,
All right. Sorry, that's a great question.
anticipate them.
All right. So, okay. Thing number one is you need to know your worth and your value. Okay. Because one of the problems is, one of the reasons the healthcare system has been so successful is because they've done a good job preying on physicians. Because we who go into the field of medicine, I mean, yes, we want a decent lifestyle, but if you really want to make money, you go in where the money is. Go into finance, right? If you want to make money, you go where the money is. People don't go into
You're
medicine.
preaching. That's
Right.
so good.
Yeah. People don't go into medicine because they want to make money. They want to help people. They like the science. They like the people. They want to make people better, and it's still somewhat of a calling. And so, and you feel like it's all about the patient. And so those administrators at the hospitals know that. And so they just ask you to do more, and they know you're going to say yes. Because you're not thinking like they're just thinking about money and dollar signs, and you're thinking about the patient. And so they take advantage of that, and it just sort of undervalues that. And they're like, fine, if you want to leave, we'll find someone else. And so sometimes it causes people, the longer you're in the system, the worse it is. It causes you to question your worth. Like, how could I ever leave this? And no one's going to want to see me. And it's not true. If you're a U.S. medical student graduate and a U.S. medical residency graduate, I don't care what field you're in, you are of value, okay? And you can provide services in the system, outside the system, and so you should always know what your value is. So, so that's number one. Number two is, change is really hard. And, having that solid paycheck is very comforting, but it's almost like, but it's hard to make the leap, but you're going to be stuck until you do. And you can do it. I mean, it's one of those things that anyone can do this. Now you have to do it the right way, but I believe that anyone can be successful in medicine on their own in private practice, whether in a direct care practice or, depending on the specialty, in just a private practice. You could do it. It can be done. And because people are sick of these big, large systems, so for example, in our area, so we're in Montgomery County, which is a suburb of DC, gastroenterology and your gastroenterology and urology. There's only one practice. There's a monopoly on both of those specialties in this area. There's no, I mean, these are both private practices, but there are these large private equity practices. And I love the doctors. The doctors are great. I train with them, train some of them. I refer to them constantly. But I know for a fact that someone could do well offering a higher level of care because you can't get an appointment. It's like a factory. So you could definitely do a direct care gastroenterology practice and be very, very successful if that's what you wanted to do. So there are always opportunities. So yes, it's scary, but just jump. You don't wait. The longer you wait, the harder it is. Know your value, know your worth. What's the other thing I was going to say? So there was one more thing that I had. I guess, yeah. So I thought there was one more, but those are the two things that come top of mind. Is that you should know your value. You are a value, and if you're not being properly rewarded and cared for in your current situation, make the leap. It is scary. There's no question it is scary. I know what the third one is. The third one is that we are not trained in the business of medicine. And so that's a super scary thing. Like basically probably going back to high school or even before, our mentality is the only way you can succeed is you study everything super hard, you get mastery of that subject, and you pass a test, and then you're successful, right? Like that's our mode of thinking. And so, oh my God, I have to take an MBA course. How can I start a practice without knowing everything there is to know about business? That's not true. Like starting a business is actually not that hard. And like no disrespect to contractors or hairstylists, but there are many hairstylists and contractors out there that have no more than a high school education and are making more money than family physicians across the country. They started their own business. It's like, passing medical school, graduating medical school, that's hard. Like passing your specialty boards, like that's really hard. Like starting a business is not that hard. Almost anyone can start a business. The only hard part of starting a medical practice is if you take insurance. The insurance part is tricky. But I didn't take insurance. That's the beauty of direct care. You eliminate that hardest part. So you don't have to be an MBA. Anyone can do this. And I guess the last thing I'll close with is that yes, it's scary. You certainly can do it yourself, but there are people out there that can help you. So that's sort of, now that I've have this established practice and I'm not taking new patients and I'm playing around with new service lines and things that I'm doing, the other thing that I like to do is I like to help young doctors start their practices, because I've made enough mistakes to help people learn from my mistakes, and I've had enough successes that I can share some of that experience. And so my business is called Direct Care Consultants. My website is directcareconsultants.com, and that's what I do. So I don't charge these big exorbitant, $10,000 for my service kind of thing. The first hour is free, and I'll give you any advice I can for free. And then if you want to continue to work with me, I charge pretty low rate by the hour, and you can use me as much or as little as you want. We can meet weekly for an hour meeting once a week, or we can have a catch up once a month for 30 minutes, or if the 1 hour is all you need, that's fine. So it's a pretty low risk thing for those people. And then there's a lot of other resources too. So there are Facebook groups. For direct primary care, there's the Direct Primary Care Alliance. So they have workshops. And so there's lots of ways. So you can read and go to conferences and do this on your own without my help or other people's help. But not everyone is a DIY person. Some people need a little bit of hand holding. And so that's available. I do that. There are other people that do that too. If you do pay for a consultant, I would say make sure you're paying a consultant who is a physician who has started this kind of practice, because a lot of the sort of practice management consultants, they don't know this space. If you want to start, an orthopedic practice that takes insurance, whatever, call one of those people. But but if you want to start your own private practice, especially in the direct care space, that's what I specialize in. Get someone who's done this once or twice if you're going to pay some money.
That is incredible. And I'm so glad you emphasized that. And that's one of the things I really wanted to hone in on, the fact that your consulting services are being offered by a physician who is also in the space. And I think that that is incredibly important. You know, I remember even med school days, I had to be so careful of who I received advice from, right? And my school of thought is, in general, if you haven't really been through it, then it's not to say that other people can't offer advice, but certain things are quite tactical, and you really just learn them as you go through. And you have this unique experience. You know, I'm so glad we did this because you've worked in the academic space, you've worked for a university system, you've seen what it's like to start something there, change it. You've had, you know, definitely great successes, but I dare say, you know, some not so great moments as well, right? So those are equally very teachable moments. So I think you have a wealth of wisdom. I hope that, you know, this video will actually reach the ends of the earth. I think every physician, actually, regardless of whether you're early stage or later, because you even started your practice later in your
Very
career,
late.
right?
Very late. I was planning on being academic for the rest of my career. This is not something that I had planned on. But ultimately, it was a decision. It was family first. My family came first. I, despite all that I had given to the institution for 20 years, I felt like, you know, I owed it to my family to be able to support them. I shouldn't have to be in debt, especially as I shouldn't have to be living from paycheck to paycheck as a teacher of medical school and a concierge physician. It just didn't seem right. So you know, I probably stayed there well too long just because I loved my job so much. I really loved it. But ultimately, it was about, you know, my family comes first, and that's why I decided to leave. So really know your value. It's very important.
Very, very important. Well, this has incredibly blessed my life. You know, I'm so grateful for you, Dr. Mintz. When I share this video, I will be sure to put the link to your consulting services. I'll put your practice as well, and the link to the consulting services at the bottom, because I hope that other physicians will take advantage of this. We'll share this on different platforms as well, so that we can increase the reach. But just know that you are an asset in the medical community. You are certainly one of the pioneers in medicine. And so I'm grateful that I got to connect with you today. And I hope that for everyone who listens, they will certainly glean something. You shared so many practical, insightful things in this conversation. So thank you.
Well, you're welcome. Well, thanks for having me.
All right.